Hi everybody, this video of mine is about heat rash. Heat rash, which is also known as prickly heat and miliaria. Please do not confuse with malaria, that's another illness. This is miliaria. This is not just for babies, it affects adults too, especially during hot, humid weather. Heat rash develops when blocked pores, which are sweat ducts trap perspiration under your skin. Symptoms range from superficial blisters to deep red lumps. Some forms of heat rash feel prickly or intensely itchy. Heat rash usually clears on its own. Severe forms of the condition may need medical care, but the best way to relieve symptoms is to cool your skin and prevent sweating. Now let me tell you the symptoms. Adults usually develop heat rash in skin folds and where clothing causes frictions. In infants, the rash is mainly found on the neck, shoulders, and chest. It can also show up in the armpits, elbow creases, and groin. Now let me tell you the types of heat rash. The types of miliaria are classified according to how deep the blocked sweat ducts are. Signs and symptoms for each type vary. The mildest form of heat rash, which is known as miliaria crystallina, affects the sweat ducts in the top layer of the skin. This form is marked by clear fluid-filled blisters and bumps, which are also known as papules, that break easily. A type that occurs deeper in the skin, miliaria rubra, is sometimes called prickly heat. Signs and symptoms include red bumps and itching or prickling in the affected area. The third type is miliaria pustulosa. Occasionally, the fluid containing sacs, which are vesicles of miliaria rubra, become inflamed and pus-filled. This form is called miliaria pustulosa because these lesions or vesicles are filled with pus. There is another less common form of heat rash that is known as miliaria profunda. This affects the dermis, which is a deeper layer of the skin. The retained sweat leaks out of the sweat glands into the skin, causing firm, flesh-colored lesions that resemble goosebumps. Heat rash usually heals by cooling the skin and avoiding exposure to the heat that caused it. You should see your doctor if your child has symptoms that last longer than a few days. The rash seems to be getting worse, or you notice signs of infection such as increased pain, swelling, redness, or warmth around the affected area, pus draining from the lesions, or if you notice swollen lymph nodes in the armpit, neck, or groin. There could be a fever or chills, and you should see the doctor in that case. Now let me tell you the causes. Heat rash develops when some of your sweat ducts clog. Instead of evaporating, perspiration gets trapped beneath the skin, causing inflammation and rash. It is not always clear why the sweat ducts become blocked, but certain factors seem to play a role, which include immature sweat ducts. A newborn sweat ducts are not fully developed. They can rupture more easily, trapping perspiration beneath the skin. Heat rash can develop in the first week of life, especially if the infant is being warmed in an incubator or is dressed too warmly or has a fever. Tropical climates. Hot, humid weather can cause heat rash. Physical activity. Intense exercise, hard work, or any activity that causes you to sweat heavily can lead to heat rash. Overheating. Overheating in general, dressing too warmly, or sleeping under an electric blanket can lead to heat rash. Prolonged bed rest. Heat rash can also occur in people who are confined to bed for longer periods, especially if they have a fever. Now let me tell you the risk factors. First risk factor is age. Newborns are most susceptible. Then comes tropical climates. People living in the tropics are far more likely to have heat rash than are people in temperate climates. physical activity. Anything that makes you sweat heavily, especially if you are not wearing clothes that allows the sweat to evaporate, can trigger heat rash. Now let me tell you the complication. Heat rash usually heals without problem, but it can lead to infections with bacteria, causing inflamed and itchy pustules. Coming to the preventive measures. To help protect yourself or your child from heat rash, you should avoid overdressing. In summer, wear soft, lightweight cotton clothing. In winter, children should dress only as warmly as an adult. Avoid tight-fitting clothes that can irritate your skin. When it is hot, stay in the shade or in an air-conditioned building, or use a fan to circulate the air. Keep your sleeping area cool and well ventilated. Now let me tell you the diagnosis. You don't need tests to diagnose heat rash. It's easy to diagnose, and we diagnose it by signs and symptoms. Now coming to the treatment, avoiding overheating may all you need to do for mild heat rash. Once skin is cool, heat rash tends to clear quickly. Ointments. More severe forms of heat rash may require ointments you apply to your skin to relieve discomfort and prevent complications. Such topical treatments may include calamine lotion, which is easily available without prescription. It soothes itching. Then comes anhydrous lanolin, which may help prevent duct blockage and stops new lesion from forming. It comes in the form of a cream. Okay. Then if there is more serious case, then we may prescribe some topical steroids. Now let me tell you the lifestyle and home remedies. These tips will help your heat rash to heal and to be more comfortable, and I'll tell you one by one. In hot weather, you should dress in loose, lightweight clothing that wicks moisture away from your skin. You should spend as much time as possible in air-conditioned buildings. You should bathe or shower in cool water with non-drying soap. Then let your skin air dry instead of toweling off. Use calamine lotion or cool compresses to calm itchy and irritated skin. You should avoid using creams and ointment that contain petroleum or mineral oil, which can block pores further. I hope you like this video of mine. If you have questions about heat rash, or if you are suffering from any other illness, please post your comments in this video section, in the comment section of this video. And if you want me to make video on any other topic, please mention it and I'll try to make video.